Hello, Health Information Alliance team, and welcome to the first virtual annual meeting of NJHIMA. For the folks watching today, please watch through the end to find out the answer to the question to enter our drawing for the $50 gift card we will be emailing to you. Could you all introduce yourselves, please?
Hi, everybody at NJHIMA. Welcome to the virtual conference. We're happy to be here. My name is Lou Testa. I'm the CEO of Health Information Alliance. I've been coming to the conference, I think all of 28 years, although there may have been a year that I personally may have missed the conference, but we're happy to be here. And Janet, would you like to introduce yourself?
Yes. Hi, my name is Janet McNeil. I'm the Chief Coding Officer for HIA.
Hi, everyone. I'm Jarrette Mansing. I'm the Associate Director at Health Information Alliance. It's great to see you all virtually. I wish we could be in person, but we're going to try this new platform and see how it goes.
Hello, my name is John Ham. I'm one of the operations managers for Health Information Alliance. I'm a graduate as an MAT, which is a medical assistant technician. And I joined the company probably about 10 years ago. So I've been to every NJHIMA meeting since then. So this is my actually virtual conference. So everything's kind of new. We're all learning. Nice to meet you.
Tell us a little bit about Health Information Alliance Incorporated.
So I guess I'll take that one. I guess as you folks see, John and I are in the same office together today, actually my home office. So we're wearing masks to be COVID compliant. Health Information Alliance is 28 years old, incorporated in 1992. We're divided into two divisions, our coding division and our performance improvement division. We have been servicing clients in the state of New Jersey since our inception. We have clients in North Jersey, Central Jersey, South Jersey, both coding clients, inpatient, outpatient, all other different types of coding. We do ED coding, we do real specific types of coding, autism coding, if those of you that may not be familiar with that, that's very specific and unique. Janet can go into more about some of the different kind of coding that we've done. We are Health Information Alliance. We're headquartered in Pennsylvania, right over the bridge. Not to be confused with another HIA, which is Health Information Associates, just so you guys are clear when people say HIA. Our other division is in performance improvement. So that division does things like core measures and all the cardiac outcomes, like Get With The Guidelines, Cath PCI, NCDR, STS. So from the HIM perspective, you may often have to work with those PI departments to understand or to provide them with more accurate or more detailed or more specific coding that feeds into their systems. So again, we're two divisions, a coding division and a performance improvement division.
And just to piggyback off what Lou said, we do have an actually staff member that does recruit either coders or core measure abstractors. What you can do is you can go online to our website and you can fill out the application, submit your resume, and what we do is we put the whoever's applying, we put them in a pool, depending on what you're applying for, whether it's ED coding, inpatient coding, outpatient coding, like we said, autism, if it's core measure abstraction, any kind of registries, NSQIP, STS, for all that.
Janet, maybe you want to talk about all the different types of coding that we do.
Yes, HIA basically can code any type of coding that you need. Inpatient, outpatient, wound care, which we are very good at, ED coding, home health, hospice, what else? Any kind of coding. We have all certified professional coders that have been with us for quite some time with a lot of experience.
Janet, what kind of credentials do our coders have?
All of our coders have either a CCS, CCA, CCP, RHIA, RHIT. They all are required to have some sort of credential.
And Janet, do we have certified coding auditors as well?
Yes, we do. We have several coders who have become auditors with the credential. So of course we use those coders for auditing on all our projects.
And the coders have to be HIMA certified, correct?
Yes, they do.
Now, outside of HIMA, don't we also do other?
Yes, along with the AAPC.
Correct. Now, Janet, how many years experience do you think that our coders have? In general, if you were to average everybody up and say, you know, I know you've been with us 28 years.
Yeah, most of our,
years.
yes, most of our coders have at least 20 years. The inpatient coders especially have at least 20 years. A lot of our pro-fee coders are up and around 10, 15 years. So we have quite a bit of experience in our coding division.
And John, from a perspective of recruitment, I know the HR department and recruitment reports under you. Don't you have a 5-year minimum of coding experience before you'll even consider them for interview?
Yes, that's correct. Usually they have to have between 3 to 5 years. Usually Janet will make that decision, you know, depending on what kind of experience they have that they reflect on their resume.
They also take a coding assessment, which they have to score at least a 95% accuracy. And if they do not, we just suggest that they come back in 6 months and retest.
So we have a pretty vigorous process in order for somebody to be even considered for, I'm sorry everyone, the masks are difficult, my glasses fog up, to even be considered to go into our coding pool. So, and once they've been recruited and then they've been tested, they go after their post-testing phase, and you know, we validated all of their professional references. We also validate their credentials. Then post-testing and that process, those folks are entered into our pool. Now, Janet maintains, not just her personally, but her team maintains a pool of hundreds and hundreds of coders that have all different specialties. Janet, do you want to talk about that pool of coders you have?
Yes. We have a group of pro-fee coders that are always ready and available should the need arise. We have inpatient, outpatient coders. We have emergency room coders, risk adjustment. Risk adjustment's a big demand right now, so we have plenty of those. We also have home health and hospice, and we are able to do the OASIS forms if that's a need that people need. And we have wound care, which I had a big hand in wound care many years ago. I did a lot of wound care coding, so I can oversee that and help out with that at any time.
And Janet, one of the things that a lot of our prospective clients ask us about is, do we offshore any of our work?
Absolutely not. We've tried that in the past, and it works out better that we just use coders from the US. They are credentialed, experienced, and there's no time difference or whatnot, so we prefer to use US coders.
Yeah, it was a process where there were so many points of validation for quality control that the cost was almost break even to the US cost with all the audits that we do from Q to Q and quality control. So Karen, I think you had some more questions for us.
I did. Thank you for all that information. However, what makes Health Information Alliance different from other companies providing coding services?
Oh, I'll grab that to start anyway. Our company is focused on project management. My background, my personal background is I have a degree in business and operations management. And then I also went to Community College of Philadelphia, pursuing the old ART, Accredited Records Technician, which is an RHIT now, for all of those courses. The point being, we take a heavy focus in project management. We come up with an implementation plan for our clients. We follow that implementation plan to a T to gain access to the hospital, to provide testing. Integrated reliability testing is especially important, with 100% audit initially and then random audits. Anytime errors are found, as long as those errors are not more than 95% accuracy, or under 95% accuracy, I should say, we re-educate, even if it's up to 99, if it's just one little error, we re-educate the coders. But should they fall under 95% accuracy, then they are re-educated, but they will be pulled from the project. Jarrette, did you want to speak more about what makes us unique?
Well, to piggyback, as a company that focuses heavily on project management, we try to adapt the process of where if we were inside medical records and the coding team had to code their cases concurrently, we make sure we assign all our coders cases on a timely basis so that they can be coded correctly, they could be audited timely, and out the door, for billing purposes, immediately. And by following that standpoint, it's just like how the hospital processes all their cases. So by following that methodology, we help the hospital stay concurrent without them falling back. And let's say the hospital had a backlog, we simultaneously work together to have the backlog worked on along with the concurrent cases, so nothing falls behind.
And Jarrette, and as far as the data analytics team, can you take a minute to talk about the type of reports that you can provide? So if we are coding for a client and perhaps their coding manager's out, or somebody else in the department, or another team within the hospital may need data. I know that you've worked with data analytics to develop pie charts and different graphs to show different trending. Can you go into a moment about that kind of reporting that we offer?
Oh yeah, of course. Internally at HIA, we do follow our own method and our own process where if we needed to do a quick snapshot to provide to the coding manager, or say somebody other than the coding manager, that they're aware of all the details of what we've been doing. And if the client does have their own internal process that they would like us to follow, we do that also. We just want to understand how they want their flow, just so we can match everything that they're comfortable seeing. And if that works for them, that's great. And then if they do adapt to our methods, that's also great. But we do provide anything that's needed on a weekly, bi-weekly, or even monthly basis, where we continually have conference calls with them, just so they're aware everything's transparent and nothing falls through the cracks.
And I'd like to add, each client that we have a different encounter, if you will. So like for instance, we had a client, and they actually lost their director, their chief coding officer, and several of their coders. So the only person that was left was the secretary, which was reporting to the C-suite. So we ended up doing their coding for them a year later or so, right? And I actually met this client at a national conference that we attend to every year. And like I said, we did the coding, and we also did the rack audits.
Yeah, I believe the people that came to the booth, it was at the National Association of Healthcare Quality. These particular folks were from the charge master. So they came to us with a charge master question. Of course, John and I are not certified coders. We were at that conference. We reached out to our coding team. Our coding team answered their questions of the problems they were having at their hospital. This was a 300-bed hospital that was in the deep south, and they were in the process of a lot of turnover. We had answered that question, and about a year later, they lost their director, they lost their coding manager. What had happened, that the charge master folks reached out to the C-suite, they contacted John. We ended up providing all of their coding, as they lost coders, the coding management, coding audits, rack audits, and it was down to just the secretary that was left at one point, until we assisted the hospital in recruiting a new director, a new coding manager, and helping train the coders to replace it so they could rebuild the entire team. So that was one of our more challenging accounts in the coding world that we had. I know, Karen, that's probably one of your questions, is it?
About the specialties in coding?
Yeah, other successes that we've had and challenges
Yes.
that we've had with coding.
Yes.
Janet, do you want to talk about any of our challenges or some of our?
Yeah, actually, I was sitting here thinking about the treatment center. We code alcohol and drug rehabilitation centers. And we came across a client in Florida for holistic treatment, which was something new to me. In turn, we wound up going down to Florida, going to the treatment center and learning all of the treatments that are given to the patients. And we coded everything, helped them along for 5 months. And it was a learning process because I never knew that there were pillows that were used to
Full body pillows.
Full body, yes. So that was a challenge, but we got through it. And
Now, Janet, you were performing CDI there, you and your team, as well as all.
yes, we also did CDI there, helping the doctors through their documentation, because they were missing out on quite a bit of reimbursement. Their levels were way too low. They didn't really know that there were certain things that if they documented it, it would increase the level and reimbursement. So the treatment center was a different type of client, but it was definitely something different. And now we understand, we have a long-term client with alcohol and drug and rehab. So we're pretty well versed in that.
And each conference can be very unique because you could go to a NACU conference, which is more of a quality conference, and pick up a coding client. Or you can go to, what's another conference that we attend, an annual HIMA. You might pick up a client that's looking to do core measures, So every conference can be unique in its own little way.
Which is what makes our company very unique, because we understand both sides of the coin. We understand the coding side, the revenue cycle side, as well as understanding the quality side, which has a lot to do with meaningful use, which has led to macro MIPS and risk-adjusted coding. So our company brings a full big picture to the whole revenue cycle and reimbursement for the healthcare system. Janet, there's one client I'd like you to talk about, which is we actually code for a very small hospital. It's tiny. I think it's 7 beds, and it's
9 beds. Yeah.
What island is it on? It's a U.S.
It's off the islands of Hawaii, but it's the hospital itself is Kwashi, which has 9 beds. It serves actually the United States Army, Navy, and some of the islanders there. The population is very small, maybe 1,000, but they reached out to us, and we actually came up with their UB04 form, and their CMS 1500. Helped them along. They had no charge master. And at this point, we're probably 2 years with them now. And even though it's not a huge facility, we do a lot of CDI for them, remote, obviously. We do a lot of consulting to help them along with their coding. And of course, their inpatient coding. But it's very unique in its own way because these are islanders that live a completely different lifestyle than we do. So it's a very interesting project.
Yeah, that's the thing with the Health Information Alliance. We have large teaching hospitals, throughout the country, many in the tri-state area, Pennsylvania, New Jersey, right in that area, Delaware. But the huge teaching hospitals are our clients. And then we have everything in between to rural hospitals. And then this tiny little island hospital that deals with not only the US military, but the islanders there. So we will not turn away any type of client, nor do we turn away anything that's unique. We have a lot of other coding vendors that come to us that they are our clients and we code for them because they can't find anybody that does the specific, unique coding that we do. I know autism was mentioned earlier, but we've done so many specific, unique types of coding that no other vendors can touch. So if you have a unique need and you don't have anyone with that experience, it's something that you should think about reaching out to Health Information Alliance about.
And we have grown a lot since when, 1992, and that's when you started the company. So I believe, Janet, weren't you doing something with in vitro fertilization?
Yes, we actually.
Janet, you want to talk a little bit about the in vitro coding?
Yes, we had a client reach out to us. It was a fertility clinic, physician's office, and they needed to know how to code their medications that are given for fertility, and then also the in vitro procedure and so on. So we helped them along with that and learned everything about their payers and so on, and got them their reimbursement because they were way off base with their coding. So that was another great experience helping them along.
I think we've kind of covered the specialties that we code. So Karen, do you want to jump to the next question?
What systems do you have experience working with?
Jarrette, do you want to take that one?
Yeah, of course. As Lou mentioned, we do help many large teaching hospitals where they adopt either Epic or Cerner. And while Epic is very unique to each facility with their install, we do take the time to understand how their process works so we know where to find every piece of data that we need to when coding. And that's also for the other side of performance improvement, just so we don't miss important key elements and things like that. But outside of those large teaching hospitals or healthcare systems, we do work with other facilities that still use older systems where it might have been built internally, or they're still in the process of a hybrid situation where, they're adopting a full EHR system. So we work with them hand in hand to make sure all documents are found, even improved upon too, as the CDI portion works into this. But, we don't shy away from any challenges that deals with their system pretty much. So we want to let everyone know that, any issues, challenges, or problems that you may with 28 years in business, Lou and Janet themselves might have already experienced it once or twice before, so they're not shy to take a stab at it.
Hey, so Janet, you and I spoke this morning. You were on a new client. We have a brand new client, a large teaching facility, and I just thought you might want to talk about you're going to be coding, or your team is, cardiac caths, and I believe, talk about the different systems we're using there without mentioning the name, mention the systems, mention the challenges, and just talk about it.
Yes, we're getting ready to begin coding cardiac catheterizations. There are 3 systems that we will be using: the McKesson, the ACES, and their own hybrid internal system.
Even though they're an Epic house, even though they're Epic across the board.
Yeah,
So there's 3 systems plus Epic, so 4.
right. Most hospitals really don't like to give up their old system. They like to hold on to that. We have another client that I think we use 4 systems, and they just don't want to give up that one system that they started out with, and they tend to put some documents in there. So when coding, that's something that happens all the time when I'm doing audits. If a coder should miss something, it's because they needed the check in the other system that, they put things in there because they feel as though everyone will look there. If it's not there, it'll be there. So, and most hospitals all seem to do that. They just won't give up that original one. So this one, they have three types of software. So it shouldn't be too bad. McKesson's a nice system, Cerner.
So Janet, they are cardiac catheter coding, and your team is going to receive them every morning from the day before, right?
Correct. We'll receive a list of patients at 6 a.m. every morning, and we will code them and return them back by 5 p.m. the same day.
So we have same-day turnaround, folks, which is something very, very unique. Same-day turnaround that my company can offer. And that's through Janet's hard work and the organization that people like Jarrette and John have offered over the years. I think our time is wrapping up. So Karen, did you have, as moderator, a last question for us?
Just any parting comments that you guys would like to give us?
Yeah, as Karen, you said in the beginning, we are doing a raffle. You can go onto the website, or you can go to, reach out to the NJHIMA website. If you have any issues, just contact myself. My information is listed under the sponsorship on the actual NJHIMA website, or you can contact Barbara Permis.
What I wanted to say, folks, is our website is www.healthinformationalliance.com. Our name.com, not difficult. We have loads of information on there. I want to thank you for attending the NJHIMA virtual conference. We hope to see you in person at a casino in Atlantic City next year. It's great to be able to share with you guys this year. So thank you all for entertaining us. Good luck winning the raffle. I know it's a fair and equal thing. I believe it's selected randomly. We'll explain more. I'm not sure how it's working through Barbara Parmes. Janet, did you want to say anything?
I just wanted to say that if you have any coding needs, I personally start the project off and follow it through for a few months, which makes our company unique. I'm available 24/7, and I stay with the client all the time.
Jarrette?
It was great meeting everybody. And like Lou said, if there was a question that needed to be answered to enter the raffle for us, please remember that HIA was incepted on 1992, and that will be your passcode to enter and fill out the raffle. So
It's 1992 to fill out the raffle. Please make sure to give us your email address, because the winner will be contacted by John via email with the electronic gift card. So folks, Janet lives in Jersey, Jarrette lives in Jersey. We're headquartered in PA. Thank you all. We appreciate your time.
Bye.
And I hope you enjoyed the conference. We hope to see you in person next year. Bye.
Bye, everyone.
Bye.